So we are going to record the meeting today. That way we are able to share it, send it back to you for you to share with your colleagues and just to watch for the future. So as I mentioned, my name is Courtney Dobernecker. I've been in the staffing industry for 10 years, started off in the nurse recruitment side and then moved over to our managed services, helping to assist with hospitals in streamlining their staffing procedures, finding the best use of their labor, both in the per diem setting, contract setting, and then their core staff. And then Nick Hovermail is joining us today. Nick, if you want to introduce yourself.
Hello, my name is Nick Hovermail with Medical Solutions. My goal and my focus is pretty simple. I want to make my partners and the people that I work with, I want to make their lives easier. I want to make their jobs easier through various forms, through a lot of the stuff that Courtney just mentioned. But ultimately, we want to be a resource, especially for those in the state of Indiana that we work with closely. So we're looking forward to today, and any questions that may pop up after the meeting, certainly shoot us an email and we'd be happy to answer them for you.
Awesome. Thanks, Nick. So as I mentioned earlier, Medical Solutions is the endorsed business partner of the Indiana Hospital Association. We have been the endorsed business partner for several years now. Very excited about the partnership, and a lot of what we do goes back to the education that they're able to provide and what we provide directly to the members. Any data, insights, market information, we are happy to provide that at any point in time, along with offering these quarterly webinars that we're doing. And then we also work with the advocacy, so helping things in your state as far as licensure, patient ratios, things of that nature. So we'll go ahead and I'll kick it off, starting with the trends and industry updates that we've been seeing. So first thing, in regards to contract assignment trends, what we're seeing as far as the highest needs in Indiana right now in the state, the first thing we notice is med-surg, and then followed by telemetry, long-term care. We are still seeing ICU, ER, and OR are still in high demand, but by no means are they where they were a year ago as far as the levels for ICU. May of 2020 last year was ICU, long-term care, and med-surg. So it has flipped a little bit, and that's in relation to the number of COVID cases changing. But we are seeing a significantly higher need for med-surg nurses in the state right now. In regards to how Indiana compares versus the national data, the national trends have risen in regards to the amount of individuals that are working contract assignments. Indiana has followed that same trend. However, one of the things that I did notice when pulling this data was the Indiana trend has leveled out a bit quicker than it has nationwide, which is a great sign for everybody in your state. What we are also seeing, which has been very interesting, is that Medical Solutions as a company has the highest number of job orders, even higher than when we did at the peak of the pandemic, which has been very interesting. And there's a couple things that have contributed to that. I'll go over those in a few slides, and Nick has them as well. But that is something that we've seen very interesting come from all of this. In regards to bill rates, some of you may have been seeing the emails that we send out monthly, going over the bill rate trends that are happening in the Midwest, and then also giving kind of a snapshot of the surrounding states with Indiana. As you see the second state listed there in the orange, we are seeing the bill rates drop from January. There was a slight increase from March to April, but it was only $3 an hour. So not a huge jump in the bill rate there. One of the common theme that is driving down these bill rates, which is a great sign for everybody, especially CFOs, is the extensions. So one of the huge benefits we're seeing with our clients now is if you do work with contract nurses right now and have those in the door, any contract staff, whether it be allied professionals, radiology, imaging, et cetera, once you have them in the door, it's much more advantageous for you to keep those individuals. If you think about it, you don't need to take the time to source somebody new to replace them. You don't have to orient or train anybody else. You've got them. And because there isn't the executive orders that are still in place as far as somebody working with any license, working in any state, that competition has dropped off. You're not seeing as much of the $200 an hour bill rates anymore. Let's say in California, that was a thing. The upper Northeast was very high rates for quite some time, as we all can imagine. So you're not having to have those competitions. So there's less and less of those open jobs. So you're able to confirm and extend the individuals you currently have on assignment, but work with them and work with the agency on getting those rates lower, which has been great. As far as growth from year over year, the billing for May of 2021 doubled since May of 2020. So some of those things are not only the increase due to the volume, but as I mentioned, you're not seeing that competition. And then when there were those high rates that were in, the coastal areas and even some other Midwest that were really struggling to find people. They had to raise their bill rates to compete with some other places that were either more attractive location wise or had great pay packages. So we had to come in line, increase rates to be able to compete for the best talent, as there is only so much out there. In regards to trends in the industry updates, the healthcare sector as a whole, the industry grew 8% from the years 2015 to 2019. And then 2020, as we all know, year of COVID, that impacted a huge result in the industry reaching $17 billion. So a big jump with that. I'm sure it's no surprise to anyone here. That's all we've heard about for the past year. But in regards to travel nursing specifically, the need for travel nurses rose 30%. And then it's expected, as far as the healthcare industry as a whole, growing 100% over the next 5 years. So definitely not something that's going away anytime soon. Looking for partners that are going to be the best fit for your culture and your organization is going to be pivotal to ensuring that you're getting the best candidates and the best quality individuals in your door to care for your patients. So as far as the need for the industry of staffing, much of this has come about due to the increased healthcare costs that we've seen. There's also an increased flexibility in where healthcare professionals can work. A lot of this is related to telehealth and the growth of the healthcare industry as a whole. So there's a lot more healthcare professionals that are considering those travel contracts. As I mentioned before, there's a rise in 30%, and the healthcare workforce is getting younger, just like the workforce across all industries in the country. The younger individuals that are entering the industry now, they are looking for those short-term employment opportunities. A lot of the younger generation that are getting into the workforce today, we're not seeing a lot of people that are, looking to take those long-term assignments. So they are looking for options where they're able to kind of pick up and go whenever they want to. So we're seeing this huge demand-driven environment, which leads to a higher bill rate and competition for travelers. So there is only so much supply that we have out there. So we do have, looks like a question here. I want to address this. So as far as disciplines of staff that are including in the average bill rates, those that were on the previous slide, what I've got mostly is RNs, but I can break that out in regards to whether it's nursing assistants, RNs, techs, or imaging. So I can get with you after that and find out exactly what you need, and I can get you a lot more specific data. And as Nick mentioned, feel free to email us with any questions. We can break down a lot of data for you, even down to specific like geographic codes as well. And then last thing that I wanted to point out in regards to the trends that we have going on right now. So there's been actually a rise in 50% of the facilities that are partnering with a managed service provider over the past 5 years. There's about 80% of healthcare facilities that are working with a managed care provider, similar to medical solutions in the industry today. That's where things are driving, and it's a great way for you to streamline your staffing and get the most bang for your buck with minimizing the work that you're doing as far as your administrative tasks. So the next thing I want to cover is the supply and demand challenges that we're seeing. As I mentioned, nursing supply is nothing new. We have been talking about this for literally a decade. In 2019, actually ranked, according to the Bureau of Labor Statistics, as the third most in demand job for any profession. The map on the right actually shows the drastic increase that we've had for needs. So as Indiana was a little bit lower than some other states that were bordering around, it still was over a 350% increase in the need for travel nurses over the past year. So something else that is nothing new, but there are a bit of a light at the end of the tunnel with this. So nursing school enrollment has not been keeping up with the pace of the projected demand. We're having the lack of necessary faculty members. Increase that with the rate of retirement. There's actually over half of the workforce is over 50 years old. So they're retiring, leaving the workforce, and thus those baby boomers are needing the advanced care. So you're seeing that aging population drive the demand. However, one of the things that we are seeing as a light at the end of the tunnel, as I mentioned, there is a 6% increase of enrollment in BSN programs in the past year. Most of this has been really contributed to nursing and healthcare being brought to the forefront, and a lot of people stepping up and feeling the need to serve and wanting to serve and go into those programs. So Indiana, great news here, actually projected to see a surplus. So by 2030, we are projected to have a supply of over 89,000 nurses covering the need for 75,000 nurses, which is awesome news. In regard to, nationwide and Indiana specific, the needs for RNs is expected to grow 12% by the year 2028 compared to 7% of all other occupations, 11% for LPNs, 9% for nursing assistants. So all of those that I mentioned are actually growing faster than the need for every other occupation. Indiana is ranked number 7 on the least amount of shortage predictions, which is great news. And then COVID can also have an impact on these numbers. So this is something we're going to keep an eye on. It's a very fluid situation. As I mentioned, there's increased retirements, not only due to the fact that most people that were up for retirement in the end of 2019 and 2020 delayed those retirements to continue helping out and serving their patients. So you're seeing the people that were up for retirement as well as those that are now due for retirement leave the workforce, in addition to individuals that are retiring early due to burnout. A recent study that we have from the Gerard Inc. actually came out with 15% of healthcare workers had reported that they were leaving the healthcare workforce by the end of the year. An additional 25% reported they were unsure about their future career in nursing and healthcare. So that could lead to a 40% drop in the supply, something we definitely want to keep an eye on and make sure that we're aware of. But as we cover this out, I want to open it up if anybody has any questions over trends or supply and demand before we kick off to Nick to go over recruitment and retention strategies. All right, Nick, I will kick it over to you.
Thank you. So I'm going to cover some items about culture opportunities, recruiting strategies, and the potential future of the market, what that may look like or what we're starting to see. So we've seen that one of the best ways to combat nurse fatigue is to surround the staff with a strong culture. It's one based on support and understanding. But it's important for leaders to understand that the concerns of their staff and to a certain extent what they can do with those concerns needs to be designed to overcome these challenges. Sometimes one of the easiest ways to ease the struggles is to simply show empathy. While many of the day-to-day tasks of healthcare professionals are teachable, there are an equal number of emotional and psychological challenges that they may encounter. Additionally, nurses may be looking for an opportunity to work in a scheduling system that can be molded to fit the demand on their lives. And while not all situations are the same, having some flexibility may lead to more satisfied employees. And while all of these things may develop a strong culture, which reduces the overall feeling of fatigue, nothing combats this challenge more than a simple thank you. Knowing your staff on an intimate level and finding unique ways to show appreciation will help create a strong work environment. Over the last year, the healthcare industry has seen many experienced professionals retiring from the workforce, with many more soon following. It's imperative that we use the time we have with these individuals to set up internal mentorships to pass their knowledge along to newer staff members. Overall, there isn't a one-size-fits-all approach to culture, but it is something that everyone can have a hand in steering in the positive direction. The recruiting landscape itself has changed dramatically over the last year, with over 68% of organizations reporting that they experience difficulty recruiting full-time staff. This makes speed interview more important than ever. A year ago, candidates were submitted to 5 to 6 jobs before getting an offer. Today, those same candidates are only speaking with 1 or 2 organizations before accepting a position. Additionally, we see more organizations utilizing the flexibility of rented talent. This can come in various forms, but the ability to be fluid in a changing economy is extremely beneficial for organizations. These temporary individuals are utilized to quickly scale up or scale down depending on organizational needs. And this can be really valuable in knowing that SHRM is reporting 50% of organizations surveyed reported budget decreases in the area of recruitment. One way organizations can look at resource savings is through the now popular virtual hiring that is taking place. In a recent LinkedIn study, it was noted that many organizations are making virtual interactions a key part of their new hiring practices. As we jump to the next slide, we'll see some other strategies here as well. One way to create an internal pool of candidates is to ensure we're developing people at all levels. So cross-training these individuals gives you an opportunity to create a list of potential candidates should a vital opening arise. Additionally, some organizations are diving into the foreign nurse programs that are offered through various outlets. And while the length of the commitment is longer, rates are often lower, and it ensures positions are staffed in the short term with an eye on future full-time placement. We often hear that organizations will use multiple international contractors at a time to ease that learning process when entering a new healthcare setting. And lastly, CareerPlug ran an analysis of over 10 million applicants and found that those that were a result of a referral were actually 85 times more likely to be hired than an applicant from a job board. This is where having a strong culture, like I mentioned earlier, can feed the growth of our teams and staffing numbers. Now that we have a little brief view on strategy, let's look at what's next. While there isn't a high level of certainty quite yet, staffing trends are showing that we are on the path to normalcy. Staffing and labor costs are expected to be the fastest growing expense in 2021. In fact, in a recent Modern Healthcare CEO Power Panel, nursing was the first position to be mentioned as a focus. According to Mercer, 77% of executives feel that contingent workforce solutions will play a pivotal role moving forward. In another return to normalcy, elective surgeries are on the rise. In fact, March 2021 procedural numbers exceeded those of March 2019. And while this may be from a halt in surgeries initially, the reality is that organizations will still need the staff to keep up. Overall, we can't predict what the future itself holds, but what we can do is stay ahead of the curve by studying and learning from the trends of our industry. With that, I want to kick it back to Courtney and we can open it up for any questions that you may have.
Awesome. Thanks, Nick. So as we mentioned, we are, definitely don't have that crystal ball as much as everyone wishes that we all had. Things are starting to slowly move back to normal. What we're using, we've got a lot of data analytics and predictive analysis that we're able to assist anyone with. So we are happy our contact information is there at the bottom of the screen. I will also reach out and send some confirmations to everyone that was on the call today. Feel free to let us know if you have specific questions on what's going on with your organization, curious things that are going on in the market, or if you just, want more information that we can give you. We have so much stuff at our fingertips and we want to be able to share that with you as much as possible. So I'll open it up to the floor for any questions at this time. Otherwise, we thank you for your time. We know it's very valuable. There's a lot on your plates. So we are thrilled that you were able to join with us and we look forward to seeing you in the future.